Today's topic is hernia. Hernia is a protrusion of viscus through an abnormal opening or a weakened area in the wall of cavity in which it is normally obtained. A hernia may occur any part of the body. Hernia means it is the protrusion of abdominal organs through a weakening part. Usually, the hernias are in two form, that is reducible and irreducible. The reducible means the hernia that easily returns to the abdominal cavity, that is known as the reducible types of hernia. And the reduced hernia, it can be done manually or it may be reduced spontaneously when the patient is in lying position. But irreducible hernia, it cannot be placed back into the abdominal cavity. That's why it is known as irreducible or incarcerated. In this situation, the intestinal flow may be obstructed, and when the hernia is irreducible and the intestinal flow and blood supply are obstructed, the hernia is strangulated. The result in intestinal obstruction. So the hernia, the strangulated hernia means when there is irreducible hernia that leads to the blood flow blockage. That's why the hernia become obstructed and it becomes strangulated. So that is known as the strangulated hernia, and strangulated hernia that cause intestinal obstruction. Okay. Other types of hernia include epigastric hernia. Epigastric hernia that occurs in the epigastric position, that is in the upper abdomen at the midline. There is weakening of the abdominal wall, so there will be protrusion of the abdominal organ. That is known as the epigastric hernia. Next one, incisional hernia. Incisional hernia that occurs at the incision site. If the patient have previous history of incision or the surgical incision, that area there may be development of hernia. Okay. So that is known as the incisional hernia. Incisional hernia that occurs at the incision site. Next one is inguinal hernias. Inguinal hernias are very important and it is a common type of hernia. And it occurs at the point of weakness in the abdominal wall, where the spermatic cord in men and the round ligament in women emerge. When the protrusion escapes through the inguinal ring and follows the spermatic cord or the round ligament, it is termed as indirect hernia. Indirect hernia, it occurs at the opening of the inguinal canal. Here the protrusion escapes through the inguinal ring and follows the spermatic cord or the round ligament. That is known as the indirect inguinal hernia. And direct inguinal hernia means when it escapes through posterior inguinal wall, that is known as the direct hernia. And inguinal hernia is most common in men. Next one, femoral hernia. Femoral hernia occurs when there is protrusion through the femoral ring into the femoral canal. So, femoral hernia that occurs protrusion through the femoral ring into the femoral canal. It occurs below the inguinal ligament as a bulge. And this femoral hernia also strangulated easily, and it occurs in women. And the umbilical hernia, it occurs at the navel level, and this occurs when the rectus muscle is weak, especially in case of obesity. There may be chance for the rectus muscle weak. So due to that, there may be chance for the abdominal contents to protrude. So here the umbilical opening fails, or in case of umbilical opening fails or the close after birth, that type also there may be chance for the umbilical hernia. So in umbilical hernia, it occurs when the rectus muscle is weak, and it occurs in two conditions, mainly in obesity, and other condition is in when the umbilical opening is fails to close or after birth. Especially in newborn, there may be chance for the umbilical hernia. And the incisional hernias, otherwise known as the ventral hernia. And this ventral hernia that occurs in obese patient, and those patients with multiple surgical procedures. Okay, so these all are the types of hernia. Types of hernia mainly classified as reducible and irreducible. And reducible is when the patient is lie down, it will be reduced. Irreducible means it cannot be reduced while patient in lying position, and it needs surgical correction. And when the irreducible is cut off the blood flow, that leads to strangulated hernia. And other common types of hernias are epigastric hernia, incisional hernia, umbilical hernia, femoral hernia, and inguinal hernia. Inguinal hernia divided into direct hernia and the indirect hernia. Thank you.